Welcome to the 7th episode of Let's Talk About It Live, where we deep dive into conversations women should be having about their hormones, but often don't. Joining me for this important conversation is founder of HealthyHome, Dr. Amber Grasse. Amber is certified from the Institute in Hormone Health, and she has a doctorate's degree in energy psychology. Kicking off this month is mental health awareness, and this topic is near and dear to Amber's heart. Amber, tell us a little bit about why you're passionate about this topic.
Yeah, thank you so much, Lindy. You know what? In my early 20s, I suffered from anxiety. And so my specialty in my doctorate was in anxiety. And I've spent over 3 decades discovering and trying to unlock what is going to be impactful for people in their mental health and well-being. And this is such an important topic because it's the whole family that gets impacted. It's not just the individual. So I'm really excited that we're bringing awareness to this topic today.
I agree. It's such an important topic. And today we're going to talk about how hormones impact your mental health. And so during perimenopause and during menopause, talk to us a little bit about what's causing increases in mental health challenges.
Yeah, so I listened to a piece by Dr. Mary Claire Haber. I always want to call her Dr. Marie. She's amazing. She's an expert in hormone health. And she explained that during perimenopause, we get these health challenges and more impactful mental health challenges, and can be old symptoms that start to poke a head up. And it can be like depression, anxiety, even your ADHD can get worse. And what happens is, I've said this before, we have estrogen receptors all over our body, but most importantly, we have strong ones in our brain. And so when the estrogen starts to decrease, this estradiol, we start to lose that receptor. And that's because there's nothing binding to them. And we see an increase in neural inflammation, and the receptors like serotonin and dopamine start to not function as well. And what shows up for a huge amount of women is anxiety, depression, and even ADHD. And so this is important to understand. It's not permanent. If you bring back and start to balance your hormone, you can have these receptors start to go back into balance.
That's good news. I'm excited to hear about that. So I feel like that there's such an important topic there that we need to give each other grace. I mean, as women, we go through so many hormone challenges and we forget that we're all in this. It's happening to all of us. And so I think you bring up such great awareness of we need to be, just give each other grace. And we did learn that women are twice as likely to develop depression as men, specifically when they're going through perimenopause and menopause. Can you talk to us a little bit about how many women are impacted by these mental health challenges?
Yeah, 100%. There are studies that more than half of perimenopause and menopausal women will have an increase in depressive symptoms. And that makes sense. If we just heard what I just said, you start to go, oh, okay, that's what's taking place as we have a decrease in our estrogen in our bodies. But women are 40% more likely to develop a mental health condition at this stage of their life. And I think that awareness is huge because we really need to start looking out for that in our health. And this is a window of risk. Your body is on alert because things are changing. And we talked about there's almost 100 different symptoms that are taking place in our body, so it can feel overwhelming. And those with moderate or have severe hot flashes or night sweats, they're 3 times more likely to get a depressive symptom sooner. And so, we really, again, it brings us back to this awareness, and what are we doing to help subsidize all of these challenges happening in our bodies and our minds? And 40% of women are going to experience mood swings and have symptoms just like we had when we have PMS. You thought that symptom, that time of our life was over. And now you're having symptoms like mood swings, anxiety, irritability, poor sleep, and it feels like you're going backwards. But these are all normal to the fluctuations in our hormones at this stage in our life.
Okay, so we've talked a little bit about those hormone fluctuations. Another thing that I feel like is causing some of this is stress. And we all live in this world where there's a million things going on. We have a very long to-do list. And I do feel like we almost glorify this idea of those that are busy are getting more done, right? If you're busy, you're active, you're running from here to there. It's almost this idea that we've glorified that. And stress has a big impact on how we're living day to day. So if we're feeling overwhelmed, can you give us a little bit of the stats behind that? What is stress and how is it impacting individuals?
Yeah, so you know how like our brains, you just nailed it, Lindy, that like our lives right now, we're running at 100 miles per hour and we kind of start to feel proud of ourselves. I think we glorify that in this new stage and age we're living in. But then if you're quiet in your own mind, you're like, I can't even think, I can't function. And there's a really specific reason for that. So stress is when your prefrontal cortex, your thinking brain turns off. Okay, so I want to just talk a little bit about this. It turns off and our amygdala, which is just this little almond shape in the middle of our brain, turns on. And that amygdala is responsible for our emotions like our fear and our anxiety. It's also responsible for the triggers of our physical symptoms like a racing heart rate or having sweat in our body. And so this response is now locked on full time. So you can't think, and there's a reason it's shut off at this moment. But here's a scary statistic about that right now. In the US, 70% of people are living with this response of stress turned on full time. 70%. And there was a study done in the UK that 90% of people are living with a stress response and burnout in their brain. Like that's extreme. We're not talking little bits. Like this is impacting our entire physiology and our brains.
Wow. So you talked about, really when we're very stressed, sometimes we go internal and we get quiet and we hear the word depression. And when we hear that, sometimes people feel like that's maybe a heavy or a very weighted word. But depression needs to be talked about just like we're talking about hormones. And so tell us a little bit more about depression and how many are impacted by that.
Yeah, so I loved this. Dr. Aditi, she's a medical doctor out of Harvard, and she's a world-renowned expert on stress. And she says that, depression, you just said it, it's a weighted word, but we kind of slough off the word loneliness, which really is a mental health condition. And it's scary how many people it's affecting in the world right now, which makes sense, kind of, post-COVID, we're living in this new world. We've kind of adapted, we've kind of become inclusive. And there's some extreme challenges to that. So I'm going to talk a little bit about that. She said that loneliness is a global epidemic and that the data shows 330 million people go 2 weeks without speaking to a friend or a family member. Now, that's alarming, but it makes sense thinking people are working from home, they're working off their phones. But more to that, the risk and the health risk is equivalent to smoking 15 cigarettes a day. And it doesn't just end with you. So get these stats. 50% of the US right now is experiencing loneliness. That's on average, but it goes up. 78% of kids in their teenage years and their 20s are experiencing loneliness. 65% of parents and 77% of single parents. And so you're not alone. Just look at the statistics. There's an increase of heart disease by 30% and stroke due to loneliness. And it actually shortens our lifespan. So we're not just talking about mental health, we're talking about the physical ramifications. And what she spoke about is like mental health is increasingly alarming to every single person in the family. That the risk for your children when a parent has excessive stress and mental health conditions, the risk to your children is that they will be 4 times more likely to get a mental health condition and it'll impact their physical health. So when we try to think of solutions, we always kind of slough off doing things for ourselves, but we really need to be aware that this is impacting the entire family, the entire community. And that's why, like at Healthy Home, heal ourselves first, and then heal the home around us.
Amber, those stats are very insightful. So, we've provided a lot of information and data around anxiety, stress, depression. It's leaving us all wondering, what can we do? What are solutions that you have for us that can make us more happy?
Yeah, thank you so much, Lindy. I think it's really important for us to look at what is taking place with our mental well-being and for us to know that we're not alone and to reach out to your community. And that can be, speaking to the people you love, your healthcare provider. There's just some impactful and important stuff that needs to take place when you're having these emotions in your body and you don't have to go through it alone. I love that there was a 75-year-old study done by Harvard, and that study was on happiness. And, we always think, well, we're going to be happy when we get the car or the house, or we lose this much weight. But he actually proved that through this studying over 75 years, it was the quality of our relationships. And we can make those simple, impactful relationship connections every single day when you're going to drop off your kids, saying hi to the parents. You know, when you're going to drop off your laundry at the laundromats, having a conversation, or getting groceries in the store. Those are just small, impactful tips that you can do every single day. And make sure that you're speaking to people in your community. And so I love, there was this book by Sean Archer, and it's called The Happiness Advantage. And he showed that positive psychology research that you can reprogram your brain and take back agency in your life. And this is important because in this time of our life, we feel like we have no control. And so I want to share just a couple different tips. And he gave 5 specific examples to rewire your brain. Number 1, each morning, write 3 new things that you're grateful for. And this trains your brain to hunt for the positive. And it can be simple things like, I had a really good cup of coffee. You know, my husband smiled or we laughed this morning for a minute. It doesn't have to be complicated. Number 2, journal 2 minutes every day about one positive experience. And if you're like, I can't think of one, it could be a conversation you had with your child. And you're going to write everything you loved about that conversation. And what it does is allows your brain, rewires your brain to relive the experience again. So you're getting that positive experience twice. Number 3, meditate for 2 minutes. You know, somebody might say, well, I prefer to pray. And that's wonderful. One of the beautiful things about what he's trying to tell you here is shut off your brain, put everything down for 2 minutes, go quiet and listen to your heartbeat. Listen to your breath for 2 minutes. And what that does is it trains your brain to focus and not get distracted. Number 4 tip that he did, random acts of kindness. And this can be, you know, a million different things you can do. But he said, this is where people get complicated. Every day, wake up and you have to send an email to 2 people saying why you're thankful for them or what they meant in your life. It could be as simple as that. And what that does is it changes your neuroplasticity in your brain. And it's just a simple thing of praising somebody else. And every morning you're looking for somebody else to praise. And then number 5 was exercise. It is the greatest antidepressant ever. And what's beautiful about exercise, we talked about this a few weeks ago, is these snack tips of just exercising for 5 minutes at a time. But he said that actually 15 minutes a day is the greatest antidepressant, and it can be lifting weights, moving our body, and it's so healthy for ourselves. And we don't have to start off with all 5 of these, right? But if you even just added 1 or 2 of them, you could significantly change your brain.
Those are brilliant, Amber. Thank you so much for sharing with us. As you mentioned, it can feel overwhelming to say, oh, I need to start working on all 5 or 6 of these tips. Start with 1. It's that simple. Start with 1 tip, and you'll start to slowly feel that mood improve. And thank you again so much for being with us. If you guys haven't listened to our previous calls, please jump onto the YouTube channel or Vimeo. Also, we're on Facebook, of course. If you're on Facebook watching this, drop us a few comments and likes. We would love to hear from all of you. And again, thank you so much for listening to these calls. And thank you, Amber, for being with us.
Oh, thank you, Lindy, for having me here.